Transforming WHO. This is actually the first episode in a new series of webcasts where we will focus on changing the World Health Organization and transforming it and making it fit for purpose, basically on the WHO transformation agenda. In this series of webcasts, I will be interviewing colleagues and friends inside of WHO as well as outside. So my name is Søren Brostrøm, I'm the Director of Transformation, and today I'm very honored to have as my guest here in the studio in Geneva, the Regional Director for the Eastern Mediterranean region, Dr. Hanan Balkhy. She has been exactly 1 year in office, and I'm going to ask her about her experiences in transforming WHO in that region. So welcome, Hanan.
Thank you very much. Pleasure to be with you.
And I'm very pleased to have you as the first guest here in this new series of webcasts. Of course, we know each other during your tenure as Assistant Director General for Antimicrobial Resistance, which was a very close to your heart and my heart as well. A little bit about your background, Hanan. You were born in Saudi Arabia and grew up in the US, and then you moved back to your country, graduated as a medical doctor from the university in Jeddah, I believe. Come from a family of medical doctors, siblings, your husband, your sons are medical doctors, and then back to the US in the 90s, doing training, residencies, fellowships in pediatrics and infectious diseases in pediatrics, and then back to Saudi Arabia around the turn of the century, and then you have had a very, very distinguished 20-year career in your country, basically leading infection prevention and control in Saudi Arabia, until, of course, you started your service in WHO, 2019,
Yes.
Assistant Director General, and then until your election a year ago. So you've been exactly 1 year in office as Regional Director of the Eastern Mediterranean region.
True.
Did I capture your impressive career?
Thank you so much. Except I have to say that my two kids escaped from being medical doctors, so they're both engineers.
They became engineers.
Yes. But no, it's been quite a fulfilling career, I have to say. And serving people from a medical perspective is a real privilege because you feel that people really trust you in their weakest moments. So thank you for having me on the show, and I'm very, very excited to talk about not just the challenges. The Eastern Mediterranean is one of the most difficult, if not the most difficult region of all 6 WHO regions because of the situation that we have in some of the countries. But also to talk about the successes and what we do to save people's lives and to make sure that they have access to health care.
We're going to talk much more about the challenges in the Eastern Mediterranean region. As you say, it's probably one of the WHO regions with the most challenges. I mean, if you sort of look at the number of graded emergencies, fragile, vulnerable settings, conflicts, crises, ongoing conflict in Sudan, Yemen, and then of course occupied Palestine with the terrible disaster that has happened in Gaza. So a lot of challenges, but also diversity in your region. I mean, you also have some affluent economies as well as some fragile countries and states. So a lot of public health challenges.
Yes. And I think the beauty of being a WHO and a global public health servant is that you get to have those diverse, and I've seen that when I was, as you said, the Assistant Director General from Geneva's perspective, looking at all 194 countries on a topic that's very difficult and affects the highest income and the lowest income countries, which is a patient not being able to be treated because there's no drugs available and effective drugs. And then moving from Geneva to the region and trying to work with the different countries, as you said, the different member states that rely on WHO for norms and standards. And if people want to know what norms and standards are, it's just generalized guidelines and treatment guidelines and how to unify the world around a common cause when it comes to health. So working in the emergency countries and the countries of conflict becomes a big challenge, which really ignited in me the necessity to expedite and accelerate the transformation process, which we're going to be talking about today. And that transformation, from my perspective, it is informed for myself from my work in Saudi Arabia when I was the director of a WHO collaborating center for 10 years. Maybe that piece is good to be captured. Then being an assistant director general in Geneva, now a regional director. So I have, I would say, a bird's eye view on what is the value of WHO, which is immense, and how can we benefit as member states from the World Health Organization, and what more can the World Health Organization provide to our member states, to the people, and what have we been providing over the years. So I'm very excited about this opportunity.
And after your election as RD, I was actually present when you were elected for the
Yes,
regional
exactly.
committee, and I sort of felt that very strong mandate that you got from the member states in the region, and I also saw the pride, of course your pride, but also the pride of your country and your husband who was there.
Thank you.
So there's a lot of responsibility also on your shoulders being elected as regional director and the first female regional director in the region. I know after you took office on February 1st last year, you've been traveling a lot in the region, and I have a couple of pictures we can just look at to see the
Yes.
sort of day-to-day life of a regional director. Can we pull up the first picture, please, of Dr. Hanan? So this is you in Pakistan, I believe. You are vaccinating a child with polio vaccine, the oral polio vaccine. Of course, Pakistan is one of the two countries where polio is still ongoing, so which are in your region. So we will, of course, eradicate polio in our lifetimes, that's for sure. But it is difficult, and especially with the fragility, etc. I mean, that poses extra difficulties. But here, I kind of sense and see the pediatrician in you, Hanan, that you were a pediatrician. Can we have the next photo, please? And this is you in occupied Palestine. It's it's a
Gaza.
field hospital in Gaza with one of the many wounded in that terrible conflict. I mean, it's really heartbreaking to see what's going on. I believe we have a third photo as well of Dr. Hanan. Yeah, this is, I believe, in Sudan, if I'm not mistaken.
This was Pakistan.
Oh, this is Pakistan.
And then the first one was actually Somalia.
Oh, that was in Somalia.
Somalia.
Sorry about that.
No problem, but the reality was both of them are for the polio immunization. So I had the privilege to vaccinate some kids. And as you know, as a pediatrician, I've done a lot of that in my previous life.
Yeah.
But to do it in the field, in a foreigner country to myself, it was a huge privilege. And to feel that within the region, as you know, we have the two final countries that actually we need to stamp out the polio virus from, which is Afghanistan and Pakistan. And indeed, I have been to both countries twice during my first term, specifically to discuss the issues of polio and how do we make it easier for children in those two countries, and specifically in Afghanistan, to make sure that they not only just receive the polio vaccine, but they receive primary health care and they're able to sustain health and access to health for their population that is very much in need.
Yeah. Very central to the WHO transformation agenda, now going on 7 years, has been strengthening our support for countries. I mean, basically, WHO does not provide health in the countries. We work with the governments and other partners and stakeholders. And we can only do that if we support governments, have a strong presence with our country offices, but also backing up from regional offices. So now 1 year in office, what have you seen traveling to the countries? How do you intend to take that transformation forward?
Thank you. So on the issue with working with governments and with authorities, because some of them are de facto authorities, some of them are legitimate authorities, but some of them are unrecognized authorities.
Yeah.
So that's the challenge that we face and we do with great pride is our health diplomacy.
Yeah.
So communicating with the authorities on the ground to really be agnostic about everything that's happening and focus on the health provision and saving lives is something that we do with a whole lot of pride. And as you said, for us to continue to do that in a very proactive way and in a very effective way to safeguard the world from emerging and re-emerging pathogens such as polio, we really need to make sure that we have enough staff on the ground, that they are safe, that they are able to take care of their own health, and that we have those channels and those avenues to leverage so that we can communicate. And indeed, this is the whole essence, if you will, of multilateralism. So multilateralism is something that we do very well in WHO. To advocate for health and well-being, and I'm very grateful to the member states that work with us from outside the region or from within the region specifically to make sure that these programs continue and that we can really eradicate certain diseases, hopefully polio very soon, but also to ensure health and access to health care.
Yeah. And of course, as we've already talked about, huge challenges in many countries in your region. I mean, looking at occupied Palestine and Gaza, I mean, there'll be a whole rebuilding effort of the healthcare system, which I think is more or less has been destroyed by this war. Of course, there will be a lot of support for that, but also in many of the other fragile environments in the Eastern Mediterranean. Can you maybe speak a little bit about the operational plan that you have instituted that also focuses on this and has polio, by the way, as a strategy? And what is the commitment also of the member states towards that operational strategy?
Perfect. So when I took office, we wanted to again start the transformation already or bring it to another level of operationalizing the regional office. So working in headquarters and being at a member state and working with WHO very closely in my previous life, I realized that the regional office in its transformation needs to take very strong steps to be very operational in supporting the member states and linking what is going on in headquarters and operationalizing that at the country level. So that means that we create a different mindset within the regional office and in our communication. So that transformation is really taking place in a very robust fashion. It has been very much needed. But we created also an operational strategy for our general program of work as WHO in a whole. And we presented it in my first regional committee meeting, which took place in October. And when you ask about the support, the member states were extremely supportive, and every single country supported that operational plan that was built with their input as well. But the other support that we've received is in the support of 3 specific flagships that will accelerate the implementation of this operational plan and takes the specifics of the needs of our member states in it, which is access to healthcare and access to medical products specifically. Number 2 is the health workforce support, and the 3rd flagship is on substance use. So these were also built during my campaign time. It was the issues that were brought to me as a candidate, an elected candidate for this position, that if you are to be elected, we want to make sure that you support the region on these 3 areas. And hence, in materializing the work is around the strategic operational plan and those 3 flagship projects.
And again, I mean, taking forward those, it needs to be a very close cooperation between WHO and the governments, the member states, through our country offices. I mean, basically advising, supporting governments to ramp up on healthcare workforce, to introduce policies and measures to tackle substance abuse, etc. Can you speak a little bit more to your vision for the country offices in the regions? I mean, how do you tend to transform them in your term in office?
So the country offices really need significant support when it talks about the skill sets for each country. And the skill sets and the diplomatic skill sets or the technical skill sets. So the transformation is going to take a much more deeper look into how do we improve those skill sets within the regional office. Training programs, ensuring that their career paths are being discussed with them, that they understand the processes. The other transformation that we're leading from the region, hopefully it will be implemented in all of WHO, is a very clear and timely succession plan for the representatives of the regional, of the WHO representatives in the country. And that is being discussed at the table right now, because when you talk about the presence of WHO and their value, we have to be on the ground all the time. And one of the things that have maybe fallen between the cracks a little bit is a clear, robust succession plan that takes many steps. But in our discussions right now with the leadership of the WHO, we will be able to move it forward.
Basically ensuring a pipeline of talent that will feed our country offices. And that's part of transformation, is strengthening our country offices. So we actually have this plan now, we call it core predictable country presence. But that's basically shorthand for assuring that we have specific capacities, positions, and we also empower our country officers more. We basically give them more power to make decisions on the ground. And in that sense, of course, the whole staff, but especially the head of our country offices, the WHO representatives, they become a
The
very
owners,
important
yes.
person,
Yes.
profile in our organization, because they need to be skilled health diplomats, they need to be technically strong,
Absolutely.
they also need to be very operational because they need to handle the emergencies, etc. That's sort of the pipeline you're talking about.
And we do have a lot of that talent that exists in WHO,
Yeah.
but they're not enough.
Yeah.
And I think that's the whole idea, is making sure that that talent is continually, that we're breeding a lot more
Yeah.
of that talent within the organization. Just to add, within our region also, in different regions, there are also specific countries that demand certain language skills as well.
Yeah.
So that's another thing that has been a bit of a challenge. Maybe we're going to focus more to make sure that that takes place.
Yeah. And of course, we live in this turbulent world. It's not only in the Eastern Mediterranean. I mean, actually, all regions of WHO, including Europe, has ongoing wars and conflicts. I mean, so what we are talking about here applies universally across the organization. And we live in a much more turbulent world. That is also reflected in our 4-year strategy, what we call the General Program of Work. So we need to manage constant changes, crises, emergencies, while at the same time making progress on the Sustainable Development Goals, which we, frankly speaking, are a little bit behind
Yes.
the 2030 goals.
Maybe just to add to that, which is, I think you bring it up even more clearly, is that the WHO is the organization that leads all the other organizations from the health perspective. So within the country presence that we have, there's something called the UN, the United Nations country teams.
Yeah.
And they have the health cluster,
Yeah.
which is usually led by the WHO representative. Now, in our work, we've created something called the Regional Health Alliance that mimics, mirrors the country teams, where we have close to 18 agencies in the regional office in Cairo, that we discuss how are we as a UN entity going to manage the different health needs at country level. So in doing that, that communication and that presence from the country level, then the regional level, is also supporting, if I would oversimplify, the sound bites of health that needs to go through the agencies to support the work that the whole UN does, along also with, I would say, the national NGOs as well.
Yeah.
And that's where we call, the member states are very familiar with the terminology health in all policy.
Yeah.
And what we've created is health in all agencies.
Yeah, exactly.
So we
Exactly.
need to continue to lead on that,
Yeah.
and that's, again, a robust 3-level communication, but very much the representative and the country offices lead it on the ground.
And of course, it speaks very much also to the unique role of the WHO. That is our core mandate.
Exactly.
Lead and convene in the health space. No other UN agencies has that mandate, and we have a special obligation. And especially in this turbulent world where the WHO is also being challenged from many sides, we need to reassert that. That's for
And
sure.
I think we want to emphasize the fact that it's a WHO mandate. And why is it that? It's because we are a member state organization.
Yeah.
And our membership is 194 plus territories. But that's a large number of countries
It is.
that actually, through our executive board and our World Health Assembly, guide us on what is needed for the best of our member states. And again,
We should never forget
two
that.
very proud WHO.
Exactly. And also two former, because you had a distinguished career working for your government, and so did I.
And so have you, exactly.
And then now we are in WHO. But I always say, WHO starts with our member states and it ends with our member states. We serve the member states, but they are the ones directing us. We should never forget that.
Exactly.
But in between that, of course, working for WHO, we have a huge obligation in serving that purpose. That's for sure.
Absolutely, yeah.
You spoke to a healthcare workforce. That's one of the priorities in your operational strategy, and that's a challenge, again, universally across all countries, low, middle, and high income. Everybody's struggling with the lack of healthcare workforce. Looking forward, we have an aging population, changing demographics, and also in the Eastern Mediterranean, more and more non-communicable diseases that we need to challenge. So basically, you have a distinguished career as a healthcare professional, also as a female. So you are also a leading star for that in your region, I guess, when you travel around and visit your member states. Can you speak a little bit to how do you see your role as a leader for the next generation of?
Thank you for for acknowledging that. I think before I respond immediately to your question, one of the biggest challenges in the region is the migration of the health workforce because of the conflict. That's one big issue that we're challenged with. So the question is, how are these countries going to sustain and make it exciting for the health workforce to continue to serve in their countries? But then also, providing the health care is not in a fancy tertiary care hospital. Sometimes, you've mentioned Gaza, they're treating patients in halfly demolished healthcare settings, no electricity, no clean water. So how do you then make it an exciting career? In high-income countries and in developed countries, they're used to, you spend your morning doing your research, then you go to the operating room, and this is not the situation. But also in some other countries where we have displaced populations. So you need a health workforce that is recognized for the significant effort they're doing to reach and access the patients who are in significant need. I think what I've been told, because it's very difficult for a Middle Easterner to speak about themselves, it's considered being too cocky, if you will.
Sorry for putting you on the spot.
But I think I feel the responsibility, even when I was back home, as a female leader and a mother, which I'm very proud, and a wife and a daughter and a sister, is how do you then mix all of those together? And it's with strong family support. But I think as a female caregiver, it is the importance of really the what we can provide when it comes to empathy and care and love to our patients. But so I'm very proud, and I get a lot of compliments and people asking me, especially young women, on how have I managed my career and being a physician and now a global public servant. It's a lot of work, I have to say, but I'm very privileged to be able to do so. We need all the men around us to continue to support us. So that's the hidden message.
But it's you seem to we lead. I mean, in this world, we need strong leadership in public health and in global health, and you seem to carry that responsibility on your shoulders. Wrapping up, I mean, just a final question. I mean, WHO is being challenged. Now we have the announced withdrawal of the United States, our biggest contributor, which is, of course, a huge challenge to the organization. But in general, more broadly, we also see challenges to multilateralism.
Yes.
How do you see global health and the future of global health in this challenged environment?
Again, it's unfortunate that the U.S. Has withdrawn, and we hope that would be reconsidered. But the whole issue of multilateralism came to become so popular is because I'm pretty sure at one point its importance and relevance was recognized. Multilateralism talks about a global community that has come closer together. And if anything, we're closer together than ever. And countries and member states are very keen about what's going on in their neighbors, whether they're immediate neighbors or a bit distant neighbors, or the member states where there's a lot of traffic population or even trade traffic. That's very important because, again, the pathogens find ways crossing borders without a visa, as we all know, and other issues such as substance use or drug trafficking or any of the other health issues that are challenging. And I believe in my heart that multilateralism will have to continue because without that without a dialogue, we will not be able to solve some of these problems. And certain countries they know how to speak to other countries better than others. And that's the essence of multilateralism. We want the best soldier to be in the front line to make that discussion happen for the betterness and the well-being of the people. So if I would guess, multilateralism is here to stay, and we're going to have to figure out ways to strengthen those dialogues. And we in WHO are always keen to find the best communicators and the best conveners to work with in addressing some of our challenges.
So multilateralism is here to stay.
Absolutely.
WHO will survive. Thank you very much for your leadership, Dr. Hanan, and thank you for taking the time to visit in the studio today. And thank you, everybody, for watching this episode of Transforming WHO, and do stay tuned for coming episodes. Thank you.